Hello, and welcome to the virtual town hall event, Air Quality and COVID-19, Connections, Health Impacts, and Racial Disparities. Before we begin, at the bottom of your screen, there are multiple application widgets you can use. All of the boxes are resizable and movable, so feel free to move them around to get the most out of your desktop space. For the best viewing experience, we recommend a wired internet connection and closing any programs running in the background that could cause issues. For the best audio quality, please make sure your computer speakers or headset are turned on and the volume is up, and make sure the media player on your screen is enabled. Please submit questions through the Q&A box, and if you have any technical difficulties during the webcast, please let us know via the Q&A box as well. This webcast is being recorded and will be available tomorrow. It can be accessed using the same link you used to register. And now we'll begin the webcast, and I will turn it over to the President and CEO of the American Lung Association, Harold Wimmer.
Thank you, and good afternoon, and thanks for joining this virtual town hall focused on the connections between COVID-19, air pollution, and racial disparities. The American Lung Association is committed to supporting research, education, and advocacy to eliminate health disparities, reduce air pollution, and mitigate the COVID-19 pandemic. Today's speakers will present the latest research on these interconnected health risks and will focus on research and public policy collaborations underway to better understand and address these critical issues. I'd like to thank today's esteemed speakers for their vital work and for sharing their time and expertise with us here today, and the American University's Center for Environmental Policy, who is our co-host for this town hall. Before we start, I'd like to mention a new initiative that the American Lung Association launched yesterday, titled Stand Up for Clean Air, with a goal to raise awareness and encourage everyone to pledge to act on climate change and clean air. Taking action to address air pollution and climate change is essential to protecting everyone's health, especially groups disproportionately impacted by these threats, including communities of color. Please join with us, learn more, and take the pledge at lung.org/air. And now I would like to introduce our moderator, Kelly Crawford. Kelly is the Associate Director of the DC Department of Energy and Environment in their Air Quality Division. And she is also the chair of the DC Department of Energy and Environment Equity Working Group. She leads a team of scientists and engineers developing and ensuring compliance with air quality regulations through the lens of equity in the District of Columbia. Kelly also coordinates efforts for local universities, state and local air quality groups, and she helps assure that we're able to address challenges and opportunities in collecting data and conducting analysis of the changes in air quality as a result of the COVID-19 pandemic. With this, I'd like to thank Kelly and turn it over to you.
Thank you, Harold. Thank you for having me here today. I'm very excited to moderate this panel with some of the interesting research that we're going to hear a little bit later. Here in the district, we operate a robust 24-hour ambient air quality monitoring network at several monitoring stations across the district. And this week, we released the district's air quality trends report. It's a living document that takes a look at the monitored ambient air concentration and criteria pollutants over time, as well as emissions from key sources. The district is attaining the national ambient air quality standards for all pollutants except for ground level ozone. Air quality in the region and in the district are impacted by emissions from a combination of stationary sources like industry, mobile sources like vehicles and transportation, and air pollution that's transported from other states, with the heaviest impacts being from those latter two categories of transport and mobile sources. In 2018, the district released its health equity report, and it found that among the 9 key drivers for health in the district, the outdoor environment was one of them. While our monitoring network is top-notch, we're in fact one of the first jurisdictions to implement the PAMS updates early. They're not, deadline is for next year's ozone season, but we've already got ours up and running. It includes a new auto GC, boundary layer measurements, a new ciliometer, and true NO2 sampling, among other things. But what the report lays bare is the need to dig deeper, to evaluate disparities in air pollution experienced by communities experiencing health inequity. To this end, DOEE has and continues to support new and innovative research and technologies to characterize air pollution, including using satellite data and other sensors to capture community-level and hyperlocal air quality data. Our monitoring network is more like the thermostat at your house. It does a great job of telling the temperature of the room, but it can't tell you who has a fever. So that's why we are working with local research partners so that we can get more refined data and make better informed decisions. With that, I'd like to introduce Dr. Francesca Dominici. She is the director of the Harvard Data Science Initiative at the Harvard University and Clarence James Gamble Professor of Biostatics, Population and Data Science at the Harvard T.H. Chan School of Public Health. She is an elected member of the National Academy of Medicine and the International Society of Mathematical Statistics. Dr. Dominici has provided the scientific community and policymakers with robust evidence on the adverse health effects of air pollution and climate change. Her studies have directly and routinely impacted air quality policy. Before she begins, I'd like to take a moment to let you know that the reference materials from today's town hall are available at the link shown on your screen, as well as in the audience resource list. Just a note, we have over 2,000 participants registered today, which is awesome. However, it means that we might not be able to get to every question, but we'll do our best to address them. If you have questions during the presentations, please feel free to share them using the Q&A feature on your screen, and we'll get to them at the end of today's presentations. You can take it away, Dr. Dominici.
Thank you. Thank you for inviting me. I am absolutely delighted to address you all. I'm going to start very quickly to make a few points that are based on our latest research on health effect of fine particulate matter, racial differences, and health effect and relationship between fine particulate matter and COVID-19 mortality. First of all, I guess this is an audience where I don't need to explain what are the effects of fine particulate matter on our health. I think it's pretty well known and established among the scientists, and clearly also as part of the American Lung Association, that unfortunately there are a very long list of adverse health outcomes that are affected by fine particulate matter. The evidence is strong, the evidence is consistent, the evidence comes from all around the world. Just very recently, actually last June 26, with my colleagues and my colleagues here, Zhao, who is a student in my lab, and Danielle Brown, also a research scientist at Harvard, we published a paper showing that long-term exposure to fine particulate matter, even a level below the national ambient air quality standard of 12 micrograms per cubic meter, increase the mortality risk. These two figures, this was a study of 570 million observations on a study of 60 million American, comprehensive, mostly, or these are all studies on people older than 65. We use 5 statistical methods, both traditional statistical method and also state-of-the-art statistical method to tease out potential causal link between long-term exposure to fine particulate matter and mortality risk. And what we found that actually a decrease of 10 micrograms per cubic meter leads to a statistically significant decrease of 6 to 7% in mortality risk. And the panel on your right shows that these risks are statistically significant and actually even higher when we study population that are exposed a level below the national ambient air quality standard. So this goes exactly, I think, in the opposite direction with the current decision of the Environmental Protection Agency of not lowering the national ambient air quality standard. Clearly that decision is not based on scientific evidence. The other element is we, and as many others, I think there is a very rapidly evolving area of research to try to understand the link between long-term exposure to PM2.5 and COVID-19 mortality rate. I think it's plausible that there is a strong link because clearly long-term exposure to fine particulate matter initiate an inflammation system in our lungs and our heart, and therefore we hypothesize that people that are exposed to fine particulate matter for a very long time can be a higher susceptibility to die after they contract the virus. I also want to mention that recently, 2 years ago, through a lead by another PhD student at Harvard, we actually published a paper showing a statistically significant association between fine particulate matter and acute respiratory distress syndrome. As many of you might know, acute respiratory distress syndrome is one of the main causes of death for COVID-19. So a recent paper, which is still under review, what we have done, we have gathered data from over 20 national databases, and we developed statistical approaches to assess the relationship between long-term exposure to fine particulate matter and COVID-19 mortality rate at county level, because that's all how the data is available right now, adjusted for many socioeconomic status, adjusted for population density, from the stage of the epidemics, and many, many more variables. What we found is that if you take two counties that are very similar to each other with respect to all of the potential confounding factors, the county that historically had the long-term exposure, higher level of fine particulate matter, have a higher mortality rate for COVID-19. This panel shows the estimates of the relative risk that are ranging as low as 7-8% to 11% as we are continuing to update our statistical analysis, as unfortunately more COVID-19 mortality it's coming. So in the paper, we stopped the analysis up to April 24, but actually in this plot, and hopefully when we'll be able to have a peer-reviewed publication, will show how these estimates are actually consistent over time. The other very important point is that Black Americans are suffering from both air pollution and coronavirus death. Through another publication that is also posted on the website, led by another junior colleague of mine, there are 2 points I want to make very briefly. The first one is a point that you all know, that over the last 16 years, or even over the last 20 years, we have been making tremendous progress in lowering the levels of fine particulate matter. One information that you might know less is the fact that, unfortunately, the inequities in exposure to fine particulate matter among different racial groups are actually higher. These maps, the two maps on the left, shows the geographical areas in the United States in the year 2010 and the year 2016 that have levels of fine particulate matter above 8 micrograms per cubic meter. So think for a moment that these are the areas where we still have relatively high levels of pollution. One thing is very concerning is that the blue dots represent the geographical area where there is where most of the Black population live, which is clearly, in the South. You see that in 2010, we have almost 50% of the population that between white and Black that were breathing levels of pollution higher than 8. In 2016, this is really concerning to me, the area that are still above 8 are mostly the area that are populated by the Black population. So super briefly, you will see, you can read the paper, but basically the bottom line here is, even though levels of air pollution in this country has been decreasing over time, the level of inequity, racial inequity and socioeconomic inequity are actually increasing over time. We are not cleaning the air consistently for everyone. And finally, I also want to make the point that when we look at the relationship between areas that are predominantly Afro-American and COVID-19 mortality rate, we found that the African-American are much more susceptible to die for COVID-19. There was actually a striking number of 49% increase in COVID mortality rate associated just with one standard deviation increase for the percentage of Black residents that live in this country. This research has having a lot of press attention, but I think the most important element I want to mention is I think it's really unbelievable that at the time of a pandemic that is affecting our lungs, at the same time the EPA is trying and is proposing not to lower the national ambient air quality standard. Clearly, our study on COVID-19 and mortality, our study on PM2.5 and mortality has an enormous amount of limitations. This is an ecological regression analysis. You cannot learn from this study biological mechanism or making individual level association, although I think it still provide a first hint to think that this link might be plausible, and therefore we need further research. I just want to thank an amazing team that I work with. None of this work would be ever possible with my colleague Zhao, Rachel Nader, Danielle Brown, and Ben Sabat. And this is now becoming a university-wide collaboration among college student, master student, PhD student. I am feeling extremely likely to have such an energetic group of people that want to better understand issues of data science, race, air pollution, and health. Thank you very much.
Thank you, Dr. Dominici. Next, I'd like to introduce Dr. Tesfaye Mirsha. Dr. Mirsha is currently an associate professor in human genetics at the Cincinnati Children's Hospital Medical Center, Department of Pediatrics, University of Cincinnati College of Medicine, where he leads the Population Genetics, Ancestry, and Bioinformatics Laboratory. Dr. Mirsha's current research includes unraveling of racial disparities in childhood asthma using multi-omics and social environmental risk factors. His long-term research goal is to understand and dissect how biological predisposition and environmental exposures interact to shape racial disparities in complex disorders. He is the corresponding author of a recent editorial in the Journal of Allergy and Clinical Immunology called Air Pollution, Racial Disparities, and COVID-19 Mortality. Dr. Mirsha?
Thank you very much, Kelly. Can you hear me? Can you hear me? Yeah, thank you very much, everybody. Thank you for joining us for this webinar. I would like to thank the organizer for organizing this very important topic at this very critical time. And well, I'm going to tell you a little bit of our research here in Cincinnati. And the good thing is Dr. Dominici presented a very good overview and some of the specifics. So I will not be dealing all the slides, so I'll go ahead and start on that. So, what is COVID-19? I think COVID-19 is one of the most frequently searched term right now. So I don't want to tell you what COVID-19 means, but the virus is a large, and it belongs to a large family of coronavirus. As most of you remember, MERS or SARS are part of this big phylogeny. So coronavirus or COVID-19 is a member of this big phylogeny. It's one of the strands. So it's just a different strand. So there are multiple signs, symptoms of COVID-19, ranging from a respiratory symptom to the pneumonia. So sometimes also you have the asymptotic type. So it's really widely variable. In terms of, one of the things I want to mention is that there is a variation in terms of risk and mortality or prevalence. If you look at the global epidemics of this COVID-19, so we put a manuscript recently. What are the different hypotheses? We put some of the ideas here, as you see in this slide. There may be some variation that's related to this COVID in terms of climate. So I'll show you some slide on that. or also hypothesize there is underlying genetic variation that leads to the risk factor, or is there some kind of natural adaptation related to infection, or is that immunity related to vaccination? Those are the hypotheses that we think leads some of the risk variation across the globe. So in this figure, as in the left side, as you can see, we put the different geographic region. In this case, we put the tropical, temperate, and the tropical region we divided into 3 categories: the African continent and other African tropical regions, and the temperate region. As you can see, the temperate region is highly heat. Of course, start early, and still it's increasing at a rapid scale. But the African continent, as you can see, it's south left, but it's not as exponential rate. So this is some of the factors I mentioned to you in the previous slide. Also, on the right side of the slide, what you are seeing is the vaccination rate that's related to tuberculosis. So as you can see, in some countries is a mandatory, some is not. So there's some studies that shows that the COVID-19 infection, or I would say severity, is related to the existing vaccination rate in a given country. So if you look at the U.S., in the U.S., this epidemic is related to minority. And the top panel is African American. As you can see, the Northeast is predominantly African American. It doesn't mean it's not in anywhere, but I'm looking in terms of density. The second from the top right panel is Latino, mostly in the southwest. So if you look at the lower panel, it's just a visual observation. The PM2.5 and the COVID-19 infection rate is actually overlapping to the minority population within the continental United States. So we look further instead of county or state level, we look at actually at the zip code level. As you can see in this figure, wherever if you live in a different county, it's actually what matters is where your zip code. So the different zip codes cluster together by socioeconomics, income, and educational status, and finally the rate of COVID infection. So this is also another interesting figure to show you that actually minorities are exposed higher than what they contributed. This is a paper published in the PNAS last year, which shows that African American actually exposed over 57% of what they contribute to the environment. Latino, even further higher, contribute over 60%, exposed to 60% that they contribute, whereas the white population actually exposed less than what they contribute. Actually, they expose 70% less than what they contribute to the environment. So this is, I don't want to go through this slide because it's already published. You may get this in this publication, the different factors that leads to COVID-19 from environment to comorbidities. So I think one thing we need to be aware that COVID-19 disparities is a kind of a sticky point. Otherwise, if you look all these diseases, there is still existing, this disparity exists for many, many years. So COVID-19 I feel it's a more of an alarming point. Otherwise, all these diseases all these outcomes are going on under the radar for many years. So it's really a good time to think about not just COVID but for all other existing health disparities. So this COVID-19, again, is the underlying factor. This is a POS study using AHR studies data. It showed that the COVID patients are actually comorbid with other diseases like cough and respiratory symptoms. So this is an interesting study to show the comorbidities are really critically important. So this is a GWAS study from a recent New England Journal of Medicine. There are some genetic variants discovered in chromosome 3, chromosome 9, related to the blood group. But I would like to warn you that this is a relatively small sample size, and this is a kind of statistical association. There is no causality or functional analysis yet. So in summary, I think there is a lot of interest looking at the ACE2 gene, which is really linked to COVID, but so far there is no association with this gene. And most interesting is what is the link between air pollution and COVID-19? Actually, it has to do with where we live, the zip code, your income, or the housing environment, which all combined lead to compromise your respiratory and, of course, leads to COVID-19 outcome. And to address this, I think we need a multi-level intervention, not just one factor at a time. So this is my final slide to show you that I think we need to tackle this problem, not just what we see from one side, rather at the individual level, at the neighborhood level, community level, at the state or government level. So it's really a multi-level effect that can contribute to slow down and eliminate these disparities. So finally, I would like to give you to mention that right now it's the best way is prevention. So so there is no vaccine, but there is research is going on at the alarming at the lightning speed. But I think right now what we have the best measure is to keep distance and as much as possible to have a protective mask. So with that, I thank my group and the collaborators at Cincinnati and some of the fundings from the NIH. Thank you very much for listening.
Thank you very much, Dr. Murcia. Very interesting. Next, I'd like to introduce our last speaker, Dr. Claudia Persico. She is an assistant professor in the Department of Public Administration and Policy at American University. Dr. Persico is also an IZA Institute of Labor Economics Research Affiliate and a research affiliate with the Institute for Research on Poverty at the University of Wisconsin-Madison and the Institute for Policy Research at Northwestern University. Much of her current research focuses on how early exposure to environmental pollution can cause inequality by affecting child health development, behavior, and academic achievement. Some of her recent work estimates that the effects of increased pollution on county-level COVID-19 death and causes using variation induced by a rollback of enforcement of environmental regulations by the Environmental Protection Agency.
Thanks so much. So thank you very much for having me here. Can everyone hear me? Okay, great. So today I'm going to present some brand new work with my co-author, whose name is Katherine Johnson. She's a PhD student at American University on the effect of increased pollution on COVID cases and deaths. So in this paper, we utilize toxic release inventory sites. So toxic release inventory sites are industrial and federal facilities that release pollution. These sites often release numerous developmental neurotoxins, and they exist in all large population centers. So this map that you're seeing is a map of all toxic release inventory sites in the United States. These include most factories, power plants, mining facilities, coal and gas, and the like. About 2/3 of Americans live within 3 miles of one of these things, and more than 60 million people live within 1 mile of a toxic release inventory site. So these things are really omnipresent. There are currently about 21,800 toxic release inventory sites operating in the US. So what do they look like? This is what a toxic release inventory site in DC looks like. This is ready-mix concrete mixer, not to single out a single site, but many of these things also just look like a typical factory. And they sort of blend into city landscapes. You drive past these things all the time and we don't think twice about it, but there's very little evidence right now on what these things might do, particularly with regard to COVID outcomes. So this is a map of Washington, D.C. As you can see, there are 11 TRI sites just in the district alone. And then outside of the district, there are even more. And this is, I should say, this is fairly typical. The district has a large number of these sites, but there are other districts that have even more of these things. Houston, for instance, in Harris County has over 300 of them. And so, you know, they're sort of scattered around all major cities in the US. And so my research questions in this paper are sort of, did the EPA's rollback of environmental enforcement, which happened on March 26th, lead to increases in pollution? And then secondly, does then this increase in local industrial pollution affect COVID-19 cases and deaths? And finally, does pollution exposure affect outcomes differentially by race and socioeconomic status? So as I mentioned, on March 26th of 2020, the United States Environmental Protection Agency announced a freeze in civil enforcement of environmental regulations due to the coronavirus pandemic. The concern here was just that it was too difficult for companies to comply with typical monitoring procedures because of the pandemic. And so the Environmental Protection Agency said that they wouldn't seek penalties if the failure to comply and monitor pollution was a direct result of the COVID pandemic. And a lot was often left up to state and local agencies to decide whether or not they wanted to enforce this. As a result, 9 states have decided to sue the EPA for suspending this pollution monitoring during coronavirus because there's evidence that I'm about to present to you that actually this caused an increase in pollution. So our research design is that we use county-level, daily county-level data from the Johns Hopkins University Systems Engineering Center on COVID-19 outcomes matched to data from the Environmental Protection Agency on air pollution and toxic release inventory sites, and data from the National Oceanic and Atmospheric Administration on weather, and also we matched this to data from Unicast on daily social distancing. We also control for stay-at-home orders, reopenings, days since the first COVID death, cumulative cases in a county, and month fixed effects. And so what we do is we compare counties with more TRI sites to counties with fewer TRI sites before versus after the EPA announced this rollback. And so what we have is a sort of natural experiment. So we employ a within county difference in differences design to estimate whether counties with 6 or more TRI sites experienced increased pollution because of the rollback of environmental regulations, and also whether that leads to increases in COVID deaths and cases compared to counties that had fewer TRI sites. So just a preview of our results, being in a county with 6 or more toxic release inventory sites after the EPA's rollback compared to counties with 1 to 5 TRI sites resulted in 13% increase in PM2.5 pollution, which is about 0.8 micrograms per meter cubed. So there was an increase. There's also an increase in ozone of about 5%. And about a 15% increase in PM10. So what this suggests is that polluters respond to the absence of regulatory enforcement by potentially increasing their pollution on average. And so while we sort of might believe that this, that the pandemic lowered pollution everywhere, that in fact has not been true. And in some places, actually pollution increased substantially because of this rollback. And particularly, it increased in these places where there are more factories and power plants and things like this. We also find that this increase in pollution led to a 38.8% increase in daily cases of COVID and a 19.1% increase in daily deaths from COVID-19. So not only was there an increase in pollution, but that this increase in pollution actually contributed to a worsening of the pandemic. And I should mention that this identification strategy uses a within county design. So I'm comparing the same county to itself before and after compared to other similar counties that had fewer of these sites. Oh, and I should also mention one additional point I wanted to make on this slide is just that an additional concern is that we also find that the worst effects were felt in counties that had a higher proportion of Black individuals. So in counties with higher than median share African-American population, we found that there's a 21.6% increase in daily deaths versus only about a 5% increase in counties that had more white individuals. So counties with more TRI sites saw bigger increases in pollution after the EPA's rollback. So this figure just sort of shows that after the rollback, in counties with sort of 3 TRI sites, you don't see very much. But as the number of TRI sites increases, so does the amount of PM2.5 that was produced in the air. So the idea is that this didn't happen everywhere. This happened in places with more industry. Which accounts for about a third of all counties in the United States saw this type of increase. In addition, counties, this is an event study of daily deaths. The purple line is counties with 6 or more toxic release inventory sites, and the black line is counties with 1 to 5 TRI sites, so that's the control group. So as you can see, counties with 6 or more TRI sites saw bigger increases in deaths after this rollback than counties with fewer TRI sites. And so there's really, they're on similar trajectories, kind of going down before the pandemic hit, and where that line is the day that the EPA announced the regulatory rollback, and then suddenly you see this huge spike in sort of cases and deaths that happened after that. In addition, counties with more TRI sites also saw bigger increases in deaths after the EPA's rollback. So you might be concerned that, maybe 6 TRI or more TRI sites is a funky number. So this disaggregates the data, and I estimate this non-parametrically, where I now am showing all the different bins for the numbers of TRI sites. So, and the omitted category in this regression is counties with 2 or fewer TRI sites. So compared to counties with 2 or fewer TRI sites, counties with 4 to 6 TRI sites see a modest increase in deaths after the rollback. Counties with 7 to 12 TRI sites, where DC is, so see a slightly larger increase, but this is really being driven by counties with 13 or more TRI sites. And so the top quintile of counties with TRI sites are really driving the majority of these results. And those are, as I mentioned, there are a variety of different types of counties scattered throughout the United States that have more heavy industry. They experience more pollution after the rollback, and then the pandemic worsened greatly in those locations. So I think that's it. I think I'm out of slides now, but thanks so much. I'm happy to answer any questions. And again, this is joint work with Catherine Johnson, who's a PhD student in my department at American.
Thank you, Dr. Persico. I'd like to just take a minute to remind everyone that if you have questions, to enter them in the Q&A function. And now we'll just do some follow-up questions. Okay, so the first question is for Dr. Mersha. Dr. Mersha, how do we address and narrow the COVID-19 racial disparities?
Well, thank you very much. I think this is a very difficult question, which all of us trying to understand and tackle. But the challenge is, health disparity is, in my view, is preventable. But it's a difference between health. It could be COVID, it could be asthma, differences among populations. So it could be preventable because it's, in most cases, it's more social factors, socio-environmental factors. So in my view, I think the first thing is we need to understand what are the root cause of health disparity. And in that case, I feel that there is structural and environmental conditions that we need to address, not just COVID, but all this all health-related disparities. So what are the neighborhood factors? How we, funding for neighborhood or access to healthcare, or education, early childhood education, and other things. Those are the factors we need to consider in terms of addressing and reducing the gap. So in my view, there should be a long-term and short-term goal in terms of COVID. The short-term is how we really test and bring access to treatment and social service for minority, so that they are not dying for no reason. So, and then follow up this long-term strategic plans that include healthcare planning and education, and especially I feel strongly that investing in education is a critical point in addressing not just health, but everything comes along the health. So education is important. So I think we need a national program a national program that targets addressing first understanding and reducing the gap in health disparity. But as I mentioned in my talk, it has to start with individual, neighborhood, and society, community level, and national level. So it's a multi-level, multifactorial research approach and intervention that could reduce the disparities that we see in COVID and other risk diseases.
Thank you, Dr. Marusha. Now I have a question for Dr. Persico. What should EPA and states do now and in the future to help protect the health of Americans?
Thanks. So I think that there are a variety of different types of things, but one point I want to stress is just that our environmental regulations protect our health. And it turns out that in the absence of these regulations, companies respond to incentives by polluting more, and also that pandemics can worsen if pollution increases. And so right now, one of the things that we could really do is uphold our environmental laws. So 9 states are currently suing over upholding our environmental laws. I think there's now some strong evidence that we really ought to be enforcing those laws and enforcing compliance, even if it's difficult during the pandemic, because in the absence of this type of enforcement, we're actually making the situation worse. And there's a huge toll in terms of human health and also death. I found in this paper that more than 10,000 additional individuals potentially died because of this EVA rollback that would not have died in the absence of the rollback. So this is, there's a mounting death toll in terms of human lives, and that's really, really unfortunate. In addition, we might consider stronger environmental regulations. We might consider particularly stronger regulations for toxic release inventory sites, which have been shown to harm children's health and development and a variety of other types of health outcomes, as well as academic outcomes. So there might be certain types of pollution that are especially bad that we might target for special types of regulation.
Well, thank you. And speaking of tightening regulations, Dr. Dominici, could you answer for us? Just this week, EPA announced a proposal to maintain the ozone standard at its current level. And it's summertime, it's ozone season, and despite reduced vehicle traffic, we're still seeing code red, code orange days in many communities. What do we know about ozone exposure and respiratory infections? And are there any studies on ozone exposure in COVID?
Yeah, thank you for that question. There is an overwhelming amount of evidence that show a link between short to long-term exposure to ozone and several adverse health outcomes, and in particularly respiratory infections. So unfortunately, as for the current decision of not lowering the national ambient air quality standard for PM 2.5, also the decision of trying, not to lower the national ambient air quality for ozone is really not based on the scientific evidence. I think the scientific evidence is pretty clear. And I think that is particularly concerning, and considering what my colleague, Dr. Persico, was saying, is particularly concerning at the time of a pandemic, where we have now started getting more and more evidence that increasing level of air pollution as a result of rolling back regulatory standard could add a significant amount of that toll. There was a study I co-authored a few years ago, published in JAMA, that actually showed that the current agenda of rolling back many of their pollution regulation would lead to 80,000 deaths in a decade. And that was not even counting and not considering and not even worrying about the COVID-19 epidemic.
Right, and that's pretty significant. Kind of staying on this topic, what research, and this is for you, Dr. Dominici, and also Dr. Persico, what is the research showing about the potential impacts on COVID-19 susceptibility from air pollution resulting from wildfire?
I think that, and I'll love also to learn from my colleague, Dr. Persico, on this area of research. I think that still we are still not ready to release a lot of research specifically on PM2.5 from wildfires and COVID. But I do think that there is a lot that we know about adverse health effect from fine particulate matter that occurring during wildfires. Some of the work I have done in the last few years shows that there was a statistically significant increase in hospital admission for respiratory infection when you were comparing a day which was within a wildfire, so considering a smoke day, versus a day that was not in a wildfire. And then, of course, and very concerning, is that these risk of hospitalization for infection associated with wildfire exposures were much, much higher among Black population and people of lower socioeconomic status. So I think although clearly the area of exposure to fine particulate matter and wildfire and COVID is a very rapidly evolving area of research, I think that at least we have a very good sense that during the wildfire, the level of fine particulate matter are much higher. And if we're still getting convinced that the level of fine particulate matter could increase the adverse health effect of COVID, you can imagine what will happen during days of high PM2.5 exposure associated, from the wildfire event.
Absolutely. I would also add that, so there's a bunch of wildfire papers suggesting that wildfires just increase overall mortality. I believe there's a paper by Julian Reif on this and colleagues. But there's no reason to think that wildfires wouldn't make the situation worse. One thing I do want to mention is that I was concerned that wildfires, not the rollback, could be responsible for the findings that I have in my paper. And so I found modeling for where the smoke from seasonal agricultural burning in Mexico is blowing. And turns out it was blowing north and east towards Florida. And I dropped all border states and still found the same types of effects, even when dropping the border states that could have been, affected by the fire. And so I think there are two things going on. One is just that there's an overall increase in pollution in areas where there are more factories because of this regulatory rollback, which is not great. And then the second is that we might get double whammied because now there might also be fires. And the combination of those two things together might be very, very bad for people. So I am pretty concerned about this.
Oh, thank you. Thank you, Dr. Persico and Dr. Dominici.
Can I add something on this?
Yeah, Dr. Murphy, do you want to chime in here?
Yeah. So I also think that, the air pollution, the PM2.5 and PM10 or ozone is a consequence of other several factors. So being a minority, probably they live in a zip code where the pollution is high, and around the highway or industry area. So, and that leads, high comorbidity with obesity and other factors. So it's a consequence of chain of events that leads to the effect of air pollution. So I just want to add those other factors that are really important beside the PM2.5.
Thank you for that, Dr. Murcia. Just to expand a little bit on Black Americans being at higher risk of COVID-19 mortality than other groups, what do you think that the key reasons for these findings are? And are the Blacks in America, in North America and the UK, currently at higher risk for COVID-19 than those living on continental Africa?
Is that for me?
Yes.
Okay, so current data showed that, if you look at genetics, the continent of Africa and the North America, African America, they are over 90%, they share similar genomic composition. But if you look at the risk right now, Africa, over 1.23 billion, the current death rate right now is around 12,000. So you can imagine how big the population, Black population in North America and the death rate compared to where the African continent. Obviously, environment plays a big role than what the genetics tells us here. So it goes to the underlying risk factor, I believe. So your environment, your neighborhood, your social structure, the environment, socio-environment factors that we always talk about, the social and environmental determinants. So those are the underlying factors that distinguish these two populations. As you mentioned, the Blacks in the UK and Blacks in the US, they have a higher rate than Blacks in Africa, African in Africa. So that, I believe, is more to do with the socio-environment and factors that goes along with that.
Thank you. Thank you, Dr. Sorry, go ahead, Dr. Dominici.
Thank you. If I may, I would like to add an excellent comment to my colleague. I think specifically in the United States, our analysis shows that zip codes that have a higher percentage of Black population have actually striking 49% increase in mortality rate for COVID-19. I think that there are several factors into play. I think first, we know that unfortunately racial and ethnic minority have a disproportionate burden of underlying comorbidity that we know increase the risk for COVID-19 in terms of diabetes, cardiovascular disease, asthma, and HIV. So there is higher comorbidity among this population. I also think that another important factor is that racial and ethnic minority tends to be employed in job that doesn't give them the luxury to stay at home and practicing social distancing. So we also know that infection rate among this population are higher. And I also think that they tend to live in an area with a higher level of fine particulate matter and pollution, and potentially, as my colleague Dr. Persico showed, is also an area with higher number, are more likely to be closer to a toxic release site. So I think there are multiple factors at play, and I think that, as has been pointed out, and being among many scientists experts on this issue, I think the COVID-19 epidemic is just putting a new lens and exacerbating and increasing the visibility in a certain way, the high concern about racial and disparity, both in access to health and both in terms of exposure to pollution.
Thank you, Dr. Dominici. That brings us to the end of our discussion today. I would like to sincerely thank everyone for joining us. The new documentary, Unbreathable, The Fight for Healthy Air, is still available for a free screening through July 19th, and it's available through the DC Environmental Film Festival. You can visit the website on your screen to watch that now, and it'll be available for a few more days, so I invite you to check it out. We also would like for you to take the pledge and learn more about the Stand Up for Clean Air campaign, and you can take the pledge at lung.org/air. And last but not least, just to let you know about two upcoming events. On August 19, American University Center for Environmental Policy will present a webinar featuring youth, climate, and clean air activists. And on September 29th, 2020, they will produce the virtual symposium, Clean Air for All, 50 Years of Clean Air of the Clean Air Act in celebration of the 50-year anniversary of the Clean Air Act. I'd like to thank Dr. Persico, Dr. Dominici, and Dr. Mercer for sharing their research and their work with us and their thoughts on how this air quality has impacted the mortality rates of COVID-19. And I thank you all for joining us.
Thank you.
Thank you.